Welcome to CBS This Morning from Washington, D.C. The new normal in America is keeping clear of the coronavirus from business to sports to family life. The list of schools and activities forced to close in order to protect public health jumped dramatically yesterday. Companies have asked millions of employees to work from home to protect their colleagues. The Dow Jones Industrial Average plummeted 10% yesterday, its worst day in more than 32 years. And the government still faces serious questions over the limited level of coronavirus testing.
CBS News is tracking the extent of testing in every state in this country. The numbers show that just over 13,000 Americans have been tested, and more than 1,700 of them have tested positive for coronavirus. The growing number of empty store shelves is a sign that we could be in for a long siege from this virus. Dr. Anthony Fauci, head of the National Institute of Allergy and Infectious Diseases at the National Institutes of Health, told a congressional committee yesterday that the testing system in the U.S. is, quote, failing. He joins us now from Washington. Dr. Fauci, good morning. I want to begin with family doctors because they're on the front lines of this fight against the virus. And I want to play a part of an interview we did yesterday with a family doctor in New Jersey discussing his frustrations with testing, and then get your message to him.
They want the doctors to start testing them in their own practices rather than sending everybody to the ER to get tested, but they don't realize that we don't have the kits yet. It's really very frustrating because we can't diagnose these people. We can tell everybody to self-isolate, but people tend to not always listen to what we tell them. And if we have people slipping through the cracks, they have the potential to infect many others before we finally catch up to them to test them.
And that, in a nutshell, is how this spreads. Dr. Fauci, what's your message to doctors like that one?
Well, obviously, that's a very frustrating situation. As I mentioned at the hearing yesterday, the original system that was set up worked for a particular type of a public health response, patient-physician relationship, order a test, et cetera. It was not designed for a much broader blanketing of the country to have tests available. That is being rapidly corrected. Admittedly, back when this particular individual had that experience, it did not work for that particular physician. But I'm looking forward now. We had a task force meeting yesterday, and we heard that the kinds of tests from the commercial sector that would be available, readily available, is really very, very close right now, very close.
Dr. Fauci, you said there'd be 4 million tests sent out by the end of this week. Are we on track for that?
There's a difference between a test being sent out and the connection between the test and those who could actually administer the test. What we really need is to get the test available in venues that people could easily access. That has not been the case. But as I mentioned just a moment ago, looking forward, it is very likely we will have that within the next week or so.
Dr. Fauci, the FDA just issued an emergency authorization for a test that can be administered and in about 3.5 hours, where you get the results back. How soon will folks be able to get those tests, and who will be tested?
Well, the situation is that the test you're referring to is really what I was just mentioning a moment ago, something that would be available that is not just going through a multiple-step process. If a person comes in right now, or at least in the next few days to a week, and has a symptom that is suggestive of coronavirus, back a week or 2 or 3 ago, there were restrictions on that. Those restrictions have been lifted by the FDA. One of the restrictions were you had to have proven contact with someone who either has coronavirus or suspected of coronavirus. That's off the board now. If you go in, there's a good reason for you to get it, you're going to get a test. But again, it's going to be graded. It's not going to all happen tomorrow or the next day. It's going to start going like this, that relatively soon, that kind of issue that was just mentioned by the person who spoke, hopefully will no longer be existent.
Now, there are going to be questions about what took so long, but for now, I want to talk about the bigger picture, how this testing, when it comes online, fits into a broader response. China has been praised for cutting the number of new cases, in part by not having home quarantine or self-quarantine. Anyone who tests positive is separated out from the population. Do we need more draconian measures like that in this country, even though we're a very different population?
You know, you could do what we call mitigation right now without necessarily having widespread testing. We certainly do want a lot more testing than we have right now. But you have to separate the difference between testing and not. The kinds of things you're hearing about, which we call social distancing, which means staying away from crowds, doing teleworking, where appropriate. Now, where appropriate, closing schools, canceling events that bring many, many people together. You can do that right now, and it's being done right now without having testing. Obviously, we want to and will have considerably more testing in the future. But you don't wait for testing to do the mitigation. You can do it right now.
Dr. Fauci, we've seen swift and unnerving changes to everyday American life. You've been in this position for 35 years or more. Can you say this is the most severe disruption to everyday living in this country in your lifetime?
Yes, of course. I mean, there have been an awful lot of challenges over the 36 years that I've been doing this. I mean, obviously, HIV/AIDS, that was a disruption for a beginning, a very selected demographic group in the country, even though there was a lot of general fear. But with regard to disruption of everyday life, we have not seen that before. But we've not had this kind of a situation before. I mean, we've had pandemics. The 2009 H1N1 swine flu was a pandemic, but, you know, it was influenza. We were familiar with what influenza does, familiar with its seasonal capability. Right now, there are a lot of unknowns, and I think that's the thing that are frightening people.
And those, you're absolutely right, those unknowns are the scary part of all this. Dr. Anthony Fauci, we thank you.